they say that over 80 to up to some studies show as high as 87% of people started out on prescription opioids before they got into heroin. And obviously, this is not rocket science. When they ask in these surveys, or studies, why did you go to heroin? They're not going to sit in our offices and be told no. They're not going to sit there for 2 hours and be told no, they're not going to get a prescription. And it's cheaper. So, I mean, hydrocodone 7.5 in Raleigh, I know that it goes for like $70 to $80 a pill, and you can get a bag of heroin for $5 to $10. So it's a little thing of heroin. So it's the economics. The total and projected cost of the opioid epidemic, this is from 2001 to 16, is about $1 trillion. Going through 20 is about another $500 billion. So putting that in perspective, I always say this opioid epidemic is a war we're in. And when they say it's not really a war, yeah, it is a war. If you look at just the war in Afghanistan and Iraq from the beginning till estimated up to about 2017, the Congressional Budget Office predicts, or estimates, I should say, that the war has cost the United States $2.4 trillion. Well, and you know, we're talking about 1.5 trillion, and it's probably more than that. So it's a very, very expensive war that we're fighting. This is from the Institute of Injury and Violence, or the study of, I always get that term, Injury and Violence Prevention Group, here in North Carolina. In 2016, there was an estimated $1.2 billion that it would cost the state in healthcare costs, legal costs, loss of job production, all the different aspects that it affects. But in just 2017, 1 year later, it's almost doubled, or over doubled, $2.5 billion total combined. And that's from the unintentional opioid deaths that we get. So it's really skyrocketing. We know that most common people that this is affecting are the white males between 25 and 54. And we're also seeing an increase in HIV, Hep C, and other issues from employment to crime to violence. And the big one that you can't really put a price on, like Dr. Horn said, is the family. The family is, I mean, it is so, I love that area to talk about, but it's the ones we have the most difficult time treating a lot of times, or finding solutions to. Some of you may have seen this graph from 1999 to 2014. These are 25 opioid overdose deaths per 100,000 in the United States. The orange represents the 25, so you can see an increase. If you go to 2015, that number goes from 27 per 100,000, and then in 2016, it goes 40 per 100,000. So what does this tell us? Well, it tells us that the opioid epidemic is on a trajectory upwards, and we're seeing here in North Carolina, the CDC has identified our state as one of the top 20 abuse states as far as statistically increases in the percentages of opioid death. You can see I always call it the Bible Belt and the Rust Belt. The Rust Belt here, the Bible Belt, is where a lot of the activity is. In Indiana, Ohio, West Virginia, Pennsylvania, Kentucky, those are the highest usually in the United States per 100,000, maybe 52 to 57 in Ohio and West Virginia. The question always comes up, why are those states more than others? Well, back in the day, there was the car industry and the steel industry and all the coal mining and everything like that, and people that were injured were taking pills. Now they can't get pills, so they're getting it from other sources. The 3 years I want you to kind of keep in your mind of this opioid epidemic that we're talking about are 1999, 2010, and 2013. 1999 is when we see the purple line there start with the increase of opioid overdose deaths, which followed this pain is the fifth vital sign kind of move. 2010, we saw an increase of heroin, and then in 2013, we saw this increase with fentanyl and its analogs. At the time, over 40% of overdose deaths involve fentanyl and fentanyl analogs, and to date, that number is actually closer to 50% of nationwide. In North Carolina, this is from 99 to 2017. You see the spike at about 2013, mainly due to fentanyl and fentanyl analogs and opioid deaths. In North Carolina from 2010 to 2017, watch this gradual increase. These are the number of analogs involved. Now we're almost at 47% of all fentanyl deaths involve an analog, not the pure form, but an analog. So it's being synthesized, I can't say that word, synthesized in China, about 98% of it. In North Carolina, still remember, I always get this question, how much longer are physicians and dentists going to have to take the 1 hour required opioid course? And I just kind of remind, we talk about these figures and stats like we've been showing, plus this one here, which goes up through 2016, it still shows that the prescription opioids are still probably the #1 cause of death. They're all right there, the synthetics and heroin too, but you see this general rise. And of course, I predict in the next few years that that'll go down, but at the same time, that's where we are as of 16. Just a few facts from the CDC, 50% of opioid overdose deaths involve a prescription drug in some form. To date, opioids now are the leading cause of death in America under the age of 50. Some of you may remember the Surgeon General back in 2016 when he announced this Turn the Tide, talking about trying to address the opioid epidemic. That was a significant time in our history with the Surgeon General making a statement like that, because the last time the Surgeon General made a statement to the nation like that, it was in 1968 when he said, women who are pregnant shouldn't smoke. I mean, he doesn't speak every year about something of a crisis, so it was a big deal. The death rate surpassed the cars, opioid deaths surpassed car crashes in the United States, and that just occurred between 16 and 17. You can see the blue line there showing the opioid overdose deaths. To the latest I could find on this, we have about 197, about 200 deaths from all deaths, drug deaths in the United States every day. If 2/3 of those are from opioids, we're looking at about 130 plus deaths a day, 1 every 12 minutes in this country. How do patients get their drugs? It's already been mentioned. Medicine cabinets, that's true. About 2/3 get them from family and friends. And the key here is they're mainly free. When drug-seeking people run out of family and friends, they have to go back to us. And I think we're going to see a resurgence of people coming back to us wanting drugs. I think that's going to happen in the next 5 years. However, there are some other solutions out there, such as the dark web. Silk Road, anyone heard of it? Okay, silkroad.com. You can order, as Dr. Horn said, any drug you want. You don't have to have a prescription. We have, we had one I used to don't show it anymore, but it was like an Amazon page. You have all the drugs listed up there. It shows you what you're buying, and it'll say, for 1.23745 Bitcoins, you can get the Christmas OxyContin special, 25 tabs of this strength, and it'll be shipped to your door within 24 hours. And so when you get it, you get to go online and give a review, and you give this guy or gal a 4.5 out of 5 stars for their delivery, how quick it was. So the dark web is always going to be there. I mean, this as far as selling drugs. The young man who started the Silk Road, he went to court and lost his battle, and within 13 minutes, they said 13 minutes after he was convicted, Silk Road 2 came up. So there's always going to be, there's not just Silk Road, there's others out there, how you can order drugs that way. The other thing that a lot of people don't want to talk about, but it's real, are the Mexican cartels. The Sinaloa Federation down in Mexico lives in basically this Sierra Madre section of it's a very mountainous region. But over the mountain, there's this golden triangle. And that's where they produce a lot of marijuana. 25% of the marijuana that comes into the United States are walked across the southern border between Texas and California. It's walked across by mules. They're given a $1,000 bonus if they can get it to the Phoenix warehouses. We're going to talk about it here in a minute. It takes about 6 days to do it on foot. So the DEA agents and all the different ones are trying to clear all that up, but it's just a constant thing. But marijuana, cocaine, meth, you name it, fentanyl. And in 2016, we know these as transnational criminal organizations, TCOs. You can spend a Saturday afternoon reading about TCOs. They're very interesting. But in 2016, The DEA reported there was about 1,300 U.S. cities that they were identified in, Baltimore, New York, and Pittsburgh, the three that are mainly the headquarters, and they recruit people to help push their drugs and deliver their drugs, and about a $29 billion dollar income they estimate from that. These are the major Mexican TCOs in the United States, and you see here in the Raleigh area, we have one in Raleigh, we have one in Greensboro, we have one in Charlotte. Atlanta's a big hub, as I mentioned, Richmond and this area up around DC and Baltimore. And there are different federations that are involved with drug trafficking. The highway system, the primary, secondary, and tertiary roads, we kind of know where these drugs are going. We see most of the trafficking, if you will, on 85 and 95 going north and south for obvious reasons. The towns, Richmond, Washington, New York, and then Atlanta and Miami. We do have some going east and west, I guess, but most of what's found is, I think, going north and south. Real estate agents, I don't know if anyone is a real estate agent or has a friend or a spouse that is, but real estate's being hit pretty hard with the opioid epidemic too. In Greensboro, a friend of mine is a real estate agent, and two of his agents lost their license because they did not properly prepare to show a house for a couple that was coming through. So people will go to show a house, they'll go through, go to the bathroom, raid the medicine cabinet, or wherever they find drugs. And so two of their agents, or two of their real estate agents, lost their license because the people that got stolen, there were two couples that got, or two houses that got people stole from, they actually reported that to the police. And if that ever happens to you, just an FYI here, the police will come and put yellow tape around your house, and it'll be a crime scene because it is a felony to steal scheduled drugs, that kind of thing. And so, do what?
Doesn't help the sale too much.
No, it doesn't help the sale. But so if you want to think twice about reporting that's you. But the other thing of veterinarians, has anyone heard what's going on with the vets in the nation? This is huge. People are purposely injuring their animals, hurting them, and they're taking their animals in. I've talked to several vets in Charlotte and around the country. These are the three drugs that they're going after. So the people bring their drugs in, from feigning panic attacks with a boxer while it storms, to the dog got caught in a barbed wire fence and the people are cutting them with razor blades, to just wanting, and these are for pain medication. Now, the veterinary boards around the country are real confused on how to handle this legally, because they're telling about a third or two-thirds, I think it's one-third, the boards are telling their vets to go on the prescription drug monitoring program list and look these patients up that are bringing their pets in to see if they're using. And the vets are saying, we're treating, Fluffy, not Dr. Mr. So-and-so, that stuff. So it's kind of a legal thing there they're trying to work through. I don't have any updates on that, but that's sort of where they are with that. But the pets are being involved. I mentioned earlier, about America, what's going on. Pain is the fifth vital sign in 1989. The government, medicine, everybody geared up and started producing more and more of the opioids. We saw an increase in addiction, increase in amounts out there. This is something kind of new. Some of you guys may have already been doing this, but we're all familiar with the pain scale that we've used forever. It's now recommended in clinical practice, at least in dentistry. I don't know how it is in medicine, but I would assume it'd be pretty similar. Instead of asking a patient, what's your pain level? And if they say a 7, they're going to say, okay, and you send them away without any pain medicine or without what they want. They're going to say, my doctor sent me away with severe to very severe pain level and didn't give me any medication. These people, as you know, our patients read PDRs, they read these drug things, they know what drug category goes with what pain level, they know what to say. So one of the efforts is now to reword this, instead of saying, what's your pain level, talk about functionality and use. So are you able to lift your grandchildren when they come and jump in your arms? Are you able to go to the football game with your son? Are you able to get up and go on a vacation? Just different things. What is your level? What's your daily activity? Can you walk to the end of the road and back? Don't talk about numbers, because patients, when they assess what their pain number is, they're wanting a drug that fits that, and they know what drug they want. Has anyone ever heard hydrocodone? We get all, in dentistry, we're always hit up with this. OxyContin, just to briefly touch on that, that's sort of the issue that started this whole opioid crisis, if you will. Some of you may have remembered that study that Jick and Porter did up at Boston University, where they had like about 40,000 patients that supposedly had no history of addiction, and about 12,000 of them got narcotics of some form, and at the end of their stay in the hospital, whether it was surgery or chronic pain or whatever, only 4 actually became addicted. So their summary was that if you don't have a history of addiction, you can take opioids safely because no one gets addicted. Less than 1% get addicted. And of course, we know that's not true. Opioids change the brain. Opioids change the physical structure, the chemical structure of the brain, and it's. But anyway, resultant from that was this huge lawsuit and reported in the New England Journal of Medicine, and I'm sure y'all are very familiar with this. This is a study that came out between 2006 and 2015 from the CDC, talking about the likelihood of long-term opioid use. They studied this and found that a one-day opioid prescription, and I really preach this, Pastor, to the dentist when I do my lectures around the state. A one-day opioid prescription representing 4 tablets will put someone at risk of still using that pill or using that prescription. 6% of the people will still be using it 1 year later, and 3% 3 years later. Now, that doesn't mean they're addicted. That doesn't mean they're, they're getting it somehow. Internet, wherever they get it. So I try to tell the dentist, that if in 2016 there were 3.5 million patients who had wisdom teeth taken out. If we gave them all these opioids, I've never written for 4. I mean, I used to write for 8, 10, 12, 15. I never wrote for just 4. But if you wrote for just 4, the study is saying that almost out of that 3.5 million patients that you've given opioids to, that a population of about 210,000, about the size of High Point, High Point I believe it is, in North Carolina, is going to become addicted or potentially abusing that drug every year. The stats the information is in. This is one of the things that we're really focused on in the state right now to try to change that. I'm in a group called the Dental Opioid Work Group. We're trying to come out with an action plan for dentists, and we're trying to focus in on this. This can't be our first choice as dentists. Now, for physicians, it may have to be in certain situations. But the STOP Act, I think, was, if you look at this, you see this gradual increase after 4 or 5 days, and after 30 days, there's another spike. So we want to talk about implementing the STOP Act and for Schedule 2 and 3 drugs, no more than 5 days for acute episodes and then 7 days for surgery patients. So why is this important? I get all the time the question, dentists, we're doing our job. Physicians, we're doing our jobs, right? We're cutting back, right? Well, I don't know if it's, obviously from the thing about the report out of Asheville, if that's true, 16,000 or 17,000 physicians still are not going by the STOP Act. The image is that, there's plenty of blame to go around for why we are actually in this situation. But the thing I want you to take home is that doctors, the perception, this was a survey of about 3,600 people back 2 years ago, a year and a half ago, that 20% of the people believe that doctors, and that does include dentists, fully responsible for the opioid epidemic. Do we have a PR problem? Do we have an image problem? Obviously we see numbers and statistics continue to go up, but what happens when the stuff starts going down? And this is the way I like to talk about it. I want you to think of a patient, and that patient is addiction, or opioid use, or opioid epidemic, and it's in ICU and it's on life support. Let's say there comes a day when all this data starts looking better, and everything's starting to come down statistically, the numbers are looking better. I would equate that with the patient being taken off of life support in the ICU. But we got a long way to go. We got to get them out of ICU, back to the floor, back home, back to counseling and treatment, and back to functioning again. It's a long way to go. We just can't say, "Oh, we got it now. We're through." So I just want you to know that there's a perception out there that doctors, 1 out of 5, believe that we were involved in causing this opioid crisis. And then this group of young people, this is where all this information and all this is occurring. I'm not going to sit here and read that to you, but We know the developing brain is quite susceptible to substance use disorder. And also, the earlier you start, as already has been said, the more likely you are to become addicted to substances. Even though dentists represent 6.2% of all opioids now being written, total number written, and the specialties of medicine are not that much higher. I mean, you break them down, there's, maybe 8-10%. So it's not like one profession is writing 45% of them. So they're all kind of evenly divided. Even with that information, dentistry still, we're the #1 prescriber of opioids to 10 to 19-year-olds, oral surgeons and general dentists. #1 prescriber of all opioids to 10 to 19-year-olds. The rite of passage for a patient to come in, or for a student to come in, a young person to come in, a teenager to come in, is the dental office for wisdom teeth and the orthopedic surgeon for ankle or shoulder injuries, from football or soccer. That's when they're most likely to be exposed to opioids, and we're doing this at alarming rates. #1, between 10 and 19-year-olds. The Journal of the American Medical Association in 2016 stated that 61% of all teenagers that went to the dentist between the ages of 14 and 17 received an opioid. And estimated that 1 out of 8 high school students use opioids recreationally for stress. Some studies have shown that to be as high as 1 out of 5. Organizations that are trying to help, you've seen these signs and billboards. I like this organization. It's from the National Family Partnership. It's called lockyourmeds.org. I know you've probably seen signs on the interstate. I like their precept, and that is that they're trying to say, parents, you may be your child's best drug dealer. And when a parent hears that, they're going to say, what? I don't give my kids drugs. But they were trying to talk about, emptying your medicine cabinet, getting rid of the medicines that are out of date, dangerous medicines, turning them back into law enforcement or pharmacies. It's the skiddling. I'm sure you've heard of skiddling, where the kids take the pills and mix them all together and sort of Russian roulette, take them and see what happens. So we're trying to get these off the street, off the shelves, not only by reducing the amount that we prescribe, but also by getting rid of them when they're out of date or not used anymore. You're all familiar, I'm sure, with the National Prescription Drug Take Back Day. It's always done in April and October of every year. Today we've collected over 5,000 tons, and we got the 18th one coming up here, April 27th. It's from 10 to 2. It's always on a Saturday. That's from the Department of Justice. And then North Carolina's SafeKidsNorthCarolina.org is equivalent to that at the state level. Now, just briefly, because I've just got a few minutes to go, I'm going to try to get through this. North Carolina last year, in 2016, we were statistically, as far as drug overdose death rates, we were just a little bit, just right under the national average. But in 2017, we're just a little bit over it. So we continue to see that dark blue. Those are the states that are above the national average. The CDC, the red states here, are the ones that the CDC is kind of keeping an eye on, and also reporting data that says, you need to do some more work in your state. You see this, North Carolina in 2016 ranked #2 in the nation, behind of all states, Nebraska, with the, you can see that up there, but anyway, the darker the purple, the more significant the overdose deaths, percentage change, and so we did see quite a big jump there. You've seen this chart, I'm sure, before, but North Carolina has